Hi, I'm Stephanie Moore with Unity Point Health, and I am joined here with Dr. Ken Cheney, also with Unity Point Health. Thanks for joining us today on our Facebook Live.
You're welcome.
We are going to talk about an issue that I'm sure people have heard about. It's the opioid epidemic and prescription drug epidemic. Let's get right down to it. How would you describe the opioid epidemic right now?
Well, I think it's a significant health problem all across the country. If you think about it, over 115 people die each day in the United States for something that is totally preventable. And many more thousands have substance abuse problems related to the opioid epidemic.
And when you hear opioid versus prescription, can those be different things?
Yes, so opioid is one class of prescription drugs, but if you think about prescription drugs, especially that young adults may use, it may be other things like sedatives, like stimulant medications that may be used appropriately for ADHD, as well as pain medicines, which would be opioids.
And that's where it comes in, where you hear prescription drug misuse versus you can use them correctly, but you can't misuse them.
Exactly. So a good example is when I was in college, if I wanted to stay up all night, I would take a cup of coffee or a pot of coffee. Now you might borrow somebody's Adderall, their prescription medication, to help you stay up overnight, and that would be the misuse.
Yeah, that makes sense. How can people safely use prescription drugs correctly? I mean, is it using what the doctor prescribed you? Is there extra steps you can take?
So I think the first thing is that the only person that should take them is the person that was prescribed, because the person chose that medication specifically for them, knowing their allergies, their history. The second thing is to take them exactly the way that the provider recommended, and if you think that they're not working or the dose needs to be changed, then I would talk to the provider. And then most importantly, secure them, because we know that many people get their medications from just medicines left lying around the house.
Yeah, that's a good point. And as you know, Unity Point Health has a prescription drug safety program that is informing teens. How important is it to inform that population, that teen, middle school, high school area?
I think it's very important, because that's when people start to make their decisions regarding their future use of alcohol, drugs, including prescription drugs. And sometimes teens feel that these medications must be safe because the provider prescribes them, they get them from the pharmacy, other people take them, but don't really realize that they may not be safe for them to take.
Yeah, that goes perfectly into my next question. Teens or adults aren't getting these drugs from a corner. I mean, it's the places that are common where people are picking these up.
Yeah, so many people will go to Grandpa and Grandma's medicine cabinet after they had a knee replacement. They may have leftover from their own orthopedic surgery or from their oral surgery. They may get mom's or their sisters, or they may just be at their friend's house and see them on the counter and take a couple of them.
When you get a prescription, a lot of times you may get more than you need or more than you end up using. Why is it important to dispose of these prescription drugs correctly?
Mainly so other people can't get into them, whether it be by mistake, by a small child, or by an adolescent or young adult looking for them. And they're easy to dispose of. You can take them to most pharmacies. Many local law enforcement agencies will also have days or even special boxes where you can dispose of them. But really, any medication, even if it's an antibiotic and not just a prescription medicine that could be abused, should be disposed of.
And it's pretty easy, I mean, to get those spots.
It's easy, but we always keep them around just in case. You know, we might need it again in the future.
And if you do need it again, you can go back to the doctor, get a new prescription.
Right, because your condition may have changed and it may not be appropriate for you for the new thing that you're trying to treat with it.
Yeah, that's a great point. You kind of touched on this, but let's talk about some more misconceptions that why prescription drugs aren't safer. You said many people are like, well, a doctor prescribes them, so they must be safe. But it really is that person's medical condition, their weight, their height. I mean, all these things are put together to give those person that medicine.
Exactly. And, you know, specifically their allergies. So they may say, well, that name, I'm not allergic to that, but it may be another chemical that's in that medication. And it also may be that for whatever condition they have at that time, that puts their metabolic condition or their physiology in a different state, and it might not be appropriate for them at that time.
And then let's talk a little bit about mental health. Is there any underlying mental health issues with anyone who misuses prescription drugs?
So it is clear that some substance abusers have mental health conditions that aren't being treated. And we tend to look at mental health illness differently in society. We don't have all the resources that we need. And so many people choose to self-medicate to try to feel better instead of getting the appropriate help that they need.
And we also have a course similar at Unity Point Health to help with mental health. Is that also an important topic to get in those young minds?
I think mental health is a really important thing, for us to be aware of our own mental health, to be aware of the mental health around us, and not to be afraid to ask for help or seek out help if we are having mental health issues ourselves.
This was all really informative. Is there anything else that we didn't touch on that you wanted to mention?
I just think, again, proper disposal is the key, and proper respect for medications. All medications have side effects. They're safe when they're chosen for you, but they need to be chosen for you by somebody who has the proper education.